everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at WellFrame. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Afterwards, stay on to have your mind blown by Silicon Valley's favorite magician, Dan Chan. And with that, I'll throw it over to our moderator, who joins us from Oliver Wyman, Marcia McPherson.
Apologies, can you hear me now?
Yes.
All right, apologies, sorry about that. A little bit of a technical issue. So again, I'll restate, it sounds like you couldn't hear me. Thank you everyone for joining our event today, and thank you to the Health and WellFrame teams for organizing what I hope will be a really wonderful discussion on filling the gaps in telemedicine. As the introduction said, I'm Marcia McPherson. I'm a partner in Oliver Wyman's Health and Life Sciences practice. I hail out of the Chicago office, where I'm spending a lot of time these days, as we all are spending time in our local home geographies. I've been in the healthcare industry for about 20 years, doing work with large payers and large provider systems on enterprise strategies and transformative initiatives that evolve the care in the healthcare space. But more importantly, I have a wonderful set of panel participants with me today that I'd love to get introduced before we dive into the content. Jacob, I'll start with you. Would you like to do a quick introduction?
Sure. Hi, everyone. Thanks so much for joining. Jake Saddlemeyer, one of the co-founders and the CEO of WellFrame. I'm an epidemiologist by training before that, and been leading WellFrame for the last number of years. So great to speak with you all today.
Sukanya, would you like to go next, please?
Great. Hi, everyone. Sukanya Sutherland. I am the Chief Strategy Officer at Blue Cross Blue Shield of Massachusetts, responsible for strategy, innovation, consulting, business planning, and enterprise data and analytics. And prior to my time at Blue Cross Massachusetts, I spent about 18 years at Oliver Wyman, where I was a partner alongside Marcia in the Health and Life Sciences practice. So it's a nice little reunion to be able to be on stage, so to speak, together again.
Yes, absolutely. And last but certainly not least, Dr. Andrea Willis.
Hi, great being here today. My name is Andrea Willis, as you just heard. I am a board certified pediatrician, a service chief medical officer for Blue Cross Blue Shield of Tennessee. I've been in that role almost 8 years now. And before that, I served in public health on the state side of the house. So good being here.
Great. Well, thank you, all three of you. I think there could not be a better array of folks to tackle the topic of filling the gaps in telemedicine and virtual care. Again, I'll remind folks on the phone, we have talked about a couple topics that we'd like to go through with this group, but we're very interested in soliciting the areas of interest that you all have on the line. And so please do use that question and answer functionality, and we'll try to weave those in as we go. I'll just set the stage via a brief introduction and the topic that we're planning to tackle and some of the key takeaways we'd look to get out of today's conversation. When we talk about at Oliver Wyman, we do a lot of work in healthcare space, and what we like to talk about in terms of new front doors of healthcare. So how do we expand healthcare access and delivery beyond the historic traditional channels of a provider's office or a facility into things like care in the home and into things like retail clinics? And a really important pillar of what we think are new front doors of healthcare of the future is the telemedicine, telehealth, virtual visit space. That's a really broad space, as you might imagine. That term, it gets broadly used and applied to lots of different kinds of capabilities across navigation and care management and engagement tools and platforms, shopping and transparency, pricing transparency kinds of capabilities, including things like virtual visits with my PCP or my specialist. And so there's a really broad waterfront of what we would put in the category of virtual health or telemedicine or telehealth. And these tools and capabilities have really been broadly available across the industry for a decade, if not more. But they've suffered from historic low engagement and adoption. It's been hard to get people, consumers and providers, to pivot from the normal course of how they receive healthcare to use some of these new tools and capabilities. I think if you had been talking about this last year, we would have been talking about how it would have been in the high single digits of overall member usage of telemedicine and telehealth adoption. And what we have seen in recent months, especially given the COVID-19 pandemic, is a massive explosion and usage of those tools and technologies. So if you take a couple of larger provider systems across the United States as evidence, Cleveland Clinic went from 800 visits per week in a telemedicine or telehealth space to 14,000 visits per week. Sutter Health has reported going from 175 visits per week to 45,000 visits per week being done virtually. Duke Health reported that they were doing less than 1% of their overall care delivery work in a telemedicine or virtual health orientation. They're now doing more than 70% of their work in that kind of telehealth space over the last several months. So there's been a really important pivot and increase and explosion in adoption of these tools, which filled a really important gap during the pandemic responses of quarantining and social distancing to make sure that people still got access to the care that they needed when they really didn't need to manage through the risk of being in person. But it hasn't come without some limitations and gaps. About 30% of people who are interested in telemedicine and using that as a channel actually they report they don't have the infrastructure to be able to access it. So they don't have broadband services, or they don't have an iPad or a laptop or even a smartphone that would allow them to participate in some of those telemedicine or telehealth access channels. And so, especially given the COVID-19 dynamic and the impact on the impact on minority communities and the impact of SDOH, it's a really important and critical opportunity that could be a useful tool, but we need to kind of overcome some of the existing barriers that still persist. And then there are regulatory and reimbursement concerns in this space as well. And so we think that telehealth and virtual visits, virtual care is a really important pillar of transforming healthcare in the future. We want to talk about one of the key takeaways today about how we see that positioned over the next couple of years, what we think are some of the barriers to overcome, and then how can we get there, and what the role of payers and providers are in that changing space. So those are some of the key topics that we'll want to talk about today. Let me open it up first to the three of you on the panel and just ask you, based on what you've seen, both historically as well as recently, what would you say is the broader kind of impact on virtual care in the future and how that will be adopted in the coming years? And Sukanya, maybe I'll start with you, given that a lot of your role is long-term strategic planning.
Sure. So Marsha, as you referenced, I think we may have seen the beginnings of hitting the tipping point in telehealth. And many people talk about how we made more progress in the span of 5 weeks in the spring than we had made in 5, 10, or even 15 years in the industry as it relates to this sort of innovation, so to speak. And so I see really 3 ways in which the future of telehealth could play out. And I think they could, all happen. They're not mutually exclusive. The first is most directly greater demand for the types of telehealth services that we've been seeing as part of the upsurge this spring. So greater usage of behavioral health from a telehealth standpoint. 45% of the telehealth claims that Blue Cross in Massachusetts has had over the last several months have been behavioral health related. And that seems to be a modality that works actually really, really well. In addition to that, there's some type of primary care and urgent care replacements, as well as routine care and chronic care management, especially with the advent of new devices that I could see really continuing to escalate and becoming more of an obvious option. If not fully telehealth, it could be a blended option of tele plus in person. So that's one. Yeah. The second is, I think we may start to see some new models of care delivery. So we might start to see some things that have historically been on the fringe, high acuity care in the home, hospital in the home, care on the go from the fringe to more of the forefront. And we're starting to see some examples of players that have been trying to advance that further, whether that be Mayo Clinic or whether that be Mount Sinai and others. And then finally, I think there's an opportunity, this is more my hope, an opportunity to try to use telehealth to help address some of the inequity issues, Marcia, that you raised, and that have also come even more to the forefront for a variety of reasons with the Black Lives Matter movement and so forth over the last few months. And is there an opportunity to use digital to access different communities in different ways that are culturally competent and relevant and useful, and that help bridge the divide and the gap in health inequities that exist today?
That's great. Thank you, Sue. Dr. Willis, I'd be really interested in your perspective as a physician yourself, having practiced and across a couple of different modalities and now kind of leading clinical strategies for a large payer system. What do you think of the future for telemedicine and virtual health?
Well, I definitely agree with the points that were just made, but I think what this did was it actually opened up the minds of those that were a little bit hesitant to adopt this before. And I mean, that's some of our in-network physicians. As you stated, we had a vendor solution in the past. It was low utilization. I think there's a place for that. So definitely not knocking that. But I think it made some people try it that maybe would not have tried it before. So that's the consumer, those are providers. So from mid-March of last year to mid-May, as compared to this mid-March to mid-May, we saw a 50 times increase in the number of claims. 7 of the top 10 diagnoses were mental health. So I do think that it did a lot in the mental health space for some people that were afraid of stigma, of actually visiting an office. It definitely helped with that. So I think the biggest thing that it honestly did is actually brought all the right stakeholders to the table. So I do think that this is an integrated part of healthcare as we go forward, and really looking as far as the innovation we can bring to it, the quality we can bring to it. I think we just wanted to do something really quick so nobody lost access, so nobody had to forego care. But now, how do we start bringing in those values in there that people have come to know? And again, how do we address social determinants of health with this mode of healthcare delivery? I mean, it's already been mentioned about the broadband. So that helps certainly with health, but then that also helps with the educational attainment, which is also a social determinant of health. So I'm very excited about the future.
Okay, great. And Jake, would be great to hear, as you know, WellFrame is a really important kind of role in the industry to help create the infrastructure and the tools and the capabilities that do engage members in between their visits even. There's the virtual visit, and I'm on my PCP, but then I've got a lot to do to manage my care in between visits, and that's where a lot of what you bring at WellFrame comes into play and helps kind of engage members with that. How are you viewing kind of the future of healthcare with virtual in play?
Yeah, I mean, I think that if you think about some of the structural reasons for why telemedicine wasn't more prevalent pre-COVID, right? You've got consumer demand and comfort. You've got provider supply. I think, Dr. Willis, your point about I'm getting some provider who I've never met, who I don't know where they're at, versus someone in network who I can also then go see in person at some point is very different. And then payer reimbursement and a lot of the regulations around, if you look at Medicare fee for service and just how restricted it was in terms of who could actually use telemedicine versus a lot of those being put aside. I think it'll depend a lot on what happens with each of those as the risks of COVID are hopefully mitigated over the coming year. And you know, the pace of that will I think be unevenly spread across different populations and across different specialties and things like that. I think in a world where, you know, there was no alternative, the provider is heavily motivated because their alternative is no revenue and nothing, where the consumer is their only way to get care, where payers said, we're reimbursing at parity, and where government said, you know, HIPAA set aside, go use Zoom, figure it out. I mean, you know, it's a perfect storm for this to happen. And thankfully, those things were made possible, right? Due to current technology and adoption of a lot of these things. I mean, if we think back, I don't know exactly what people did in the last pandemic, but I have to imagine it was a lot worse. And so really grateful that all of that groundwork had been put in place in the preceding decade plus to make that possible. it's certainly a tipping point, and certainly things will never be the same again, but how different they are, I think, will depend a lot on each of those factors. I do think we'll settle into more of a hybrid where, you know, my parents have been hoping to see their, an orthopedic person, and, you know, virtual is just not really doing it for them at this point. But obviously on the behavioral health side, tremendous opportunities to address unmet need. So I would envision things kind of leveling out. You know, I think as we do focus on really using technology to organize healthcare resources around the needs of individuals, especially those with chronic disease in between clinical encounters or formal interaction. You know, telemedicine solves a lot in terms of convenience and accessibility, but it's still a 13-minute encounter where 99.9% of someone's life is in between. We do think that as more people are trained to use digital and virtual channels to access care, and more solutions are coming out to fill in some of those gaps, people will be acclimated to looking to digital as a way of getting support, not just when they're talking to a physician, but in between. And I think those are some exciting opportunities that we see for our partners.
Yeah, okay, that's great. I do see a couple of questions specific to this that from the audience that I might kind of dig into off the top here. A couple of questions around mental health and digital health solutions. I think you all hit on the importance of these platforms and technologies to address behavioral health. There was also a couple of questions around how does telehealth work in an environment where there's much more kind of hands-on needed kinds of care delivery aspects? So how do doctors get vital signs for telehealth visits, or how do we envision physical medicine like PT, OT, and chiropractic using telemedicine? And so Dr. Willis, I might turn to you for your perspective on a couple of those spots of how do we penetrate virtual medicine and telehealth into spaces that have been much more hands-on or physical medicine oriented?
Well, I think there's a few things. For example, most visits really start with a triage. We don't really think about that. I mean, if you go to the emergency room, you get triage. When you go to your provider's office, the first thing they ask, what's going on with you today? So I still think that's available through telemedicine. It's just a matter of allowing that triage point and then deciding if somebody needs something else. So if they need to still come in, and those were still options, not the preferred option when everybody was being asked to stay at home, but I still see it being a triage point. It doesn't solve everything, and it shouldn't solve everything for everybody. So I definitely see it that way. One of the other things that I think I really got out of this is that it's allowed providers to really go back to that thing that we learned in medical school, to really listen to what the patient is telling you. So much of a diagnosis actually comes from the history. So I think it's let us go back to really honing in on that history and having a plan from there. And sometimes the plan may be, you know, can you get a blood pressure cuff from Walmart and then let me know? And then there are ways like remote patient monitoring has been mentioned or alluded to here. So there's ways to connect devices digitally so that information can be received, you know, real time. So I think that's going to be more and more prevalent as we go forward. But right now it's a triage. It's a triage to let us know what more needs to be done.
So it's an augmentation of the care delivery experience that can be done via a different channel that would have gotten done anyway, that then can lead to better navigation of that person to the right next step in the care delivery spectrum, versus having to have that done in the office. Is that right?
Exactly. So it's only to augment clinical judgment. It's never meant to be a substitute for clinical judgment.
Yeah, that's great. One of the topics that we talked about a little bit as a panel, and that I see consistent with some of the questions coming in from the audience, is consumer engagement in this, consumer adoption, and that has a lot to do with the experience within the telehealth and telemedicine space. A lot of the recent increase in usage of these tools has been because they've had to. There has been no other real way that without risk to get access to care. As we think about, Jake, your future kind of view of this being a really important but mixed approach for healthcare, not the only way that you can get access to healthcare as it has maybe been for some parts of the country for the last several months. The engagement, adoption, and experience parts of that become a really important aspect for maintaining that momentum of usage. And so, Sue, I might ask you, kind of as you've done consumer studies and have thought about how to make sure that that experience comes through to maintain kind of consumer expectations when they are using a telehealth modality. How do you think about the importance of that and how to maintain and evolve that over time?
It's a great question, Marcia. It's clearly critical, and I think what we're starting to see is some of the expectations that consumers have had outside of healthcare, where our lives are digital and kind of run off of our phones, are starting to infiltrate into healthcare. And that's going to cause us to have to raise the bar. It ups the ante for all of us who are in healthcare, who are trying to meet our consumers' needs. Because, you know, we all experience and how we, you know, go out to eat, or back when we used to go out to eat, now when we order food, or, you know, when we used to go on vacation and so on and so forth. We do use Netflix. So, you know, in terms of our entertainment now, it's consumed differently than it was 10, 15, 20 years ago. And so we're going to have to find ways to continue to meet the consumer's expectations and bar. I will say so far, a lot of the initial responses that I've seen and some of the survey work that I've seen have demonstrated that consumers have been pretty satisfied with the virtual options that they had in light of COVID, right? So, and I think there's been a halo around that too. People have understood that these were extenuating circumstances. But I don't think that's something we can just sort of rest on our laurels on at this stage, because again, the expectations will continue to rise. They're going to be looking out for continuity of care. They're going to be looking to see, like, do I have to repeat myself 17 times over? Did you see that I already did this? I already got that test. This is where data interoperability could come in and potentially be helpful. And we'll need to continue to, just like consumer packaged goods companies and other industries, track consumers' hassle maps. You know, what are all the different hassles that consumers have, and how do we address those? What's the severity and the frequency of those? And how do we improve upon them? We're going to have to bring that level of discipline to our offerings moving forward.
Yeah, and Jake, I know your team does a lot of work in that space as you've built your solutions and technologies, at looking at out of industry experiences and making sure that the programs and the solutions that you bring have a really high engagement and experience factor. How are you thinking about what's really important in the future to keep meeting those consumer expectations and increasing that engagement?
Yeah, I mean, one of the conversations we have internally is that, you know, if you could use the analogy of telemedicine might be today where the electric typewriter was when they first, you know, you're first able to punch the keys, right? And now we have MacBook Pros that do things that we never would have envisioned when we had the electric typewriter. So I think taking an in-person visit with a physician and putting a screen in front of it is a great step, right? And it does impact accessibility and it gives people options. But we think about that as a one beachhead in a portfolio of digital investments that will, over time, I think, enable the healthcare system to reorganize how they provide resources to people and the kind of relationship that they have with people. And I think we'll go through different phases where you can see at this point, there are a lot of different attempts to fill gaps here and to digitally enable things or to digitally translate things that are kind of point solutions and may end up with a bit of a fragmented experience, right? Where I get telemedicine here and I get remote monitoring here and I get digital care management here and I get you know, customer service questions answered here. But over time, I think there's the opportunity, especially for large healthcare organizations that are thinking about this less as something on the fringe and more as the core as you look over the coming decades, to start pulling those things together and offer an experience that could start with a virtual relationship before anybody needs to see a physician, where this is where you get questions answered about your bills and who to go see and what your symptoms are doing. And then you open up a digital channel with people, you open up relationship people, and when they need to get care from a physician, it's much more seamless and you have that context and that information going into it. Because I think if it's just like, all right, I'm gonna play, you know, chat roulette with the physician here and see who I get to talk to, and then that's it, and my data goes nowhere and nobody knows, I think it's really gonna be limited. But I do see where we're at today as a start of a long journey, and certainly what's happened over the last several months, I think will accelerate our path on that journey.
Yeah, that's great. I think the other aspect of this, so there's the experience both on the provider and the consumer side, but there's also the quality part of this as well. Dr. Willis, you brought that up in our internal conversations preparing for today on how it's really important to create this as an access channel for care, but it's also really important to make sure that there's the quality outcomes via this modality that we all come to expect and, you know, have put in place for historic in-person models. Would love to have you share what you're thinking about in terms of monitoring and tracking that quality and making sure that's a robust part of the telemedicine and virtual health space in the future.
Absolutely. So the healthcare system in general was moving towards more value-based approaches. So where you're really rewarding based on quality metrics and outcome data. And so that's what we need to look at here. And we know that data is still accumulating. But at the end of the day, we want to see, you know, just right off the top, like, did these visits accomplish what, you know, we had hoped they would, what the patient had hoped that it would? Did people end up in the emergency room anyway after the visits? Those type things. So we really want to know, did they stick to their medications? Things like that. So there are some really high level things that you can think about. But I think as we go forward, as we want to see this stay and we want to see this integrated into practice, we still want to reward on those same things. So I think it has to be a very comprehensive thing. It can't be off to the side. I think it has a better chance of being fragmented, like Jake talked about, if you really don't look at it as being an integrated piece of a value-based model. So that's where we're going to start. And then we'll have those conversations with our providers and we'll share data on how it turned out, you know, as far as the outcomes and things like that, because we want this to be collaborative as we look to put that in the contracts going forward.
Yeah, and you touched on in that kind of commentary around having this be part of a value-based arrangement. You touched on some of the contracting and the reimbursement elements about that. That has been a really big part of payers' responses recently in COVID to, you know, adjust the reimbursement policies. And that varied from state to state. And I see a number of questions from the audience around how will payers think about it in the future, because many of them responded and brought reimbursement amounts for a telehealth visit up to where an in-person visit was. But that was, in some cases, done on an interim basis. And so there are a lot of questions in the industry, and I can see in the question and answer panel around how will payers decide how to tackle that going forward? What's the thought about reimbursement, both from a PCP as well as a specialist, as well as kind of more of a hospital type of encounter? And so, Sukanya, maybe I can go to you first in terms of how you're thinking about those reimbursement and payment policy evolution as you move into the post-pandemic phase.
It's a great set of questions, and I wish I knew the answers to them all. I think it's really, truly a set of questions that are part of a large-scale national and state-by-state dialogue right now and debate. You know, I think on the one hand, digital and telehealth are meant to represent an opportunity to get to greater convenience, greater affordability and lower costs, and potentially greater outcomes and quality. But to Dr. Willis's point, there's still work to be done to really assess. Now that we're starting to collect more large-scale data on how this works, I think the CMS and the CBO are currently trying to identify and track what the impact is, and truly, you know, how is it working? We have been at Blue Cross Blue Shield of Massachusetts, we have been paying at parity, Marcia, as you referenced, and we'll continue to do so as per our governor's orders. And that's really our best effort to try to ensure that our members are getting access to care in a safe and a timely fashion, and that we're being supportive of our physicians' needs. So we're paying for telephonic visits, as an example, at the same rate as in person as well, in case telehealth video visits are not available. I think, you know, the question that remains, and it remains to be seen, so I know it's an unsatisfying answer for folks, is how is this going to play out? You can envision how, you know, for providers, it's been an investment for many of them in new systems and technology and webcams and so on and so forth. For many consumers and some whom we've surveyed, they've liked the experience, but they think it isn't quite the same as in person, so they think it should be at a discount. And so you could envision over time, for consumers, especially those that are on a high deductible plan, you know, they get a bill and it's like, oh, that was $120 for, you know, 15-minute visit via, you know, video. And that might be like, I just saved not having to take an hour or 2 hours off from work. You know, I just saved, you know, not having to pull my kid out of school. I just saved myself a trip to the ER, in which case, huge value add. For some others, it may be like, I didn't quite get what I would have gotten if I had been in person with my provider. So I think there's a lot that remains to be seen. And this is an area to watch, because ultimately it is a lever that could help us get to greater affordability. We don't want unwanted utilization and so forth. But on the other hand, it has to be done right. To Dr. Willis's point, it has to be done in a way that meets the quality needs of our entire membership base.
Yeah. Dr. Willis, anything you'd add from the Blue Cross Blue Shield of Tennessee perspective on kind of how you're thinking about evolving payment policies? Again, a lot of factors to consider in that space.
Absolutely. Well, we're paying at parity now as well. It felt like definitely the right thing to do during this crisis, and we're not going to rush away from it. Again, we want the data to come in, and we want to have those quality conversations and figure out how it fits into a value-based structure. Because really, when you think about it, anytime it's quality care, the last thing that should happen is that more costs are injected into the healthcare system. So we want to be sensitive to that, and we want to make sure that the patients have quality. So again, it's a collaborative conversation, not running away from parity. Just want to have that conversation with the providers and talk about the quality metrics and the outcome metrics.
Mm-hmm. That's great. Yeah. There's a few questions actually, Jake, that from the Q&A that I think might be interesting to get your perspective on, in terms of, we often talk about telehealth in terms of like the patient engaging with a virtual visit or the patient engaging with an app. But there are a few interesting comments in the questions around, should patients be able to talk to each other? Should caregivers be able to engage differently in that space, be able to kind of join a virtual visit for the person that they're a caregiver for, or to create connectivity, especially during the pandemic, between someone who's in the hospital and their family who's not allowed to be at their bedside. And so would love to get your perspective on how you're thinking about the way that the virtual health and telemedicine could open up to a broader participation between caregivers and the people that they are helping to navigate the care environment for.
Yeah, I mean, certainly one of the major, some of the major benefits of digital and the internet in general is connecting people and sharing information, right? And so I think as we think beyond a patient and a physician for 13 minutes doing their thing, there's a whole portfolio of resources that I think are possible to connect. And certainly in our trajectory with WellFrame, where we started in digital care management, have been starting to expand the breadth of resources within a health plan and then beyond. As we think about providers and other resources, you want to really get all those resources organized around the patient or the caregiver, right? And we do a good amount of work in Medicare and Medicaid, where it is often a caregiver who's operating on behalf of an individual and is best suited to be interacting with a care resource with that person's consent. And certainly there's value in connecting patients with each other, and we've seen a lot of value from everything from informal social networks to expert peers that are there to support in a very non-judgmental, supportive way as people are navigating through periods of vulnerability. I think the trick will be being able to organize all these different resources in a way that feels contiguous for that individual. And isn't, okay, I've got 50 different apps that I go to get to support to all these different things. And maybe that will be fine for a certain amount of time, but it's really about how those individuals can organize around a digital or virtual channel to collaborate in supporting people's needs. And I think there's some parts of that are easier than others. And as is the case, technology is a component of the challenge, but there are other business and relationship reasons that some of these things don't happen right away as well. But I think with digital, we'll encounter those sooner, and we'll have opportunities to break down some of those barriers in ways that have been really hard through in-person or live interactions that are very hard to share in the ways that you can through technology.
Right. And that does change. That implies a change on how the providers need to manage kind of each of their visits. And there's a number of questions that I can see in the Q&A around how are providers feeling about this shift to telemedicine, how they have to then interact with their patients, or maybe having patients and caregivers, or even community-based organization workers, I saw that in the comments as well, participate in a visit. Are they having to spend a lot of time getting a patient like set up and ready to do a visit before they can actually do the actual delivery of care? And so would love, Dr. Willis, for you to kind of comment on what are you hearing from your provider network and how they're maintaining or making this pivot successfully, and how they're thinking about building this into their practice regimens going forward?
I think especially if it was already an established patient, I think that helped ease them into the experience. So it was just having a conversation with somebody they already knew. So I think that took down a wall for some of them that thought, I just don't ever want to do that type mode. And then some of them had kind of been doing this type thing all along, and this just went to the next level for them. So I think it really actually reduced some anxiety, because I think the first instinct is I've got to help. And in this environment, this was the way to help. So I think it helped a lot. And I think, just the patients being willing to accept care this way also brought them comfort. Again, I think a lot of it, because it is a relationship, I don't think they went into it thinking this is the only way I'm going to see my patient, but this is the way I can help my patient through this time. And so I think that will help them to start thinking about how they can integrate it into their practices going forward. So we've had some skeptics before this period that are now cheerleaders for this type of experience.
Yeah. Have you seen something similar, Sue?
Yeah, so I would underscore all of what has been said. I think the providers in our network went to great lengths, as I think providers did across the country, to quickly turn on a dime and do whatever it took. And I think some of the heavy lifting around like all the work of having either doctors or office staff calling people in advance and saying, we're changing this appointment, download this app, do this, do that, has kind of happened now. So I think some of that initial heavy lifting has been executed against, including even just getting the doctors trained on, here's how you do this and here's how you work it. So I think that has happened. And I think, some of the provider community in our network with whom I've spoken have also talked about how they're using this to think in new ways about, to Dr. Willis's point, how might we think about e-triage differently, and triage differently up front, and how might we utilize more physician second opinion services or support some of our more rural hospital physicians in different ways, and so forth. The other piece I will reference, and this is more of a comment from a national system level, as I've talked to some of my peers, so chief strategy officers at other systems across the country, one of the resounding themes that I heard from a handful of them is that they don't see this going away, particularly given that we're not anticipating we're going to just bounce back to normal anytime soon. And so they're really starting to rethink their staffing models. They're starting to rethink their capital deployment models. And, many of them have said, we can't imagine going back to the way things were before. And one, pointed to an example where she said, envisioning our patients all, taking a 45-minute drive into the city to come in, pay 30, 40 bucks for parking, sit in a crowded waiting room for 30 minutes, and then drive back again for 45 minutes, when I could have been sitting on my living room couch and having the same interaction with the doctor with whom I already have a rapport. And again, this is where the hybrid model sometimes can be really helpful. They just said it doesn't seem to make as much sense. So I think, I'm not speaking for all providers by any means, or necessarily all in my network here in Massachusetts, but what I'm hearing from many different systems in different parts of the country is that this has been an opportunity for them to say, what could we do differently, and how do we reimagine how care is delivered moving forward? Yeah,
great. I'd like to touch on, and there were a couple of, you mentioned it in a couple of spaces, and there have been some questions in the Q&A panel around how does telemedicine help address social determinants of health and inequities across healthcare? or does it further exacerbate those things? And so, Jake, I might just start with you in your perspectives of, you've got a technology asset that is really valuable, and how you make sure that it can get to the broadest part of the population that you're trying to serve as possible, knowing that there are infrastructure challenges. And how are you thinking about that space?
Yeah, I think it can be complicated, right? There are a lot of factors involved. I think back to when we started the organization, we would be criticized for being stupid because older or sicker or poorer people would never use smartphones to do anything relative to their health. And it was for, young, rich people. And we're like, no, that's like, this is where things are going. And so if you look at the last 6 or 7 years, so much has changed, right? In terms of adoption and use, but it's still not universal. And there still are disparities in consumer adoption of technology that will matter here, as well as infrastructure. You referenced broadband before, and that applies to patients, but it also applies to physicians. And one of our clients is providing subsidies for rural physicians to get broadband, because otherwise they were going to be in a really tough spot relative to being able to do telemedicine. So I think that with any new technology, it's unequally distributed early, but overall, over the long term, the goal is to increase access to what works. And certainly, as we were founded, the focus was, let's take what we know works and let's use technology to make it more convenient and more accessible, and kind of reimagine the way that it looks. I think that overall, if you look at some of the data coming out of CMS, it was encouraging to see access through telemedicine. If you look across age and gender and ethnicity and rural, urban, I think it was, everybody was gaining access, not exactly the same, but a little bit more uniformly than I would have assumed. But if this is going to be a primary channel and one that people rely on, I think there are investments that need to happen there, right? And so just as we're thinking about more and more social drivers as healthcare issues, I think technology and the use of technology can be thought of that way as well. And that puts in the purview of healthcare organizations, hey, if this is a critical way for me to engage with my patient or with my member, what's my responsibility in terms of making that accessible if we know that it improves outcomes? And I think this is where payment model becomes so critical, right? And so as we're talking about kind of how do providers respond over time, when the alternative to telemedicine is zero revenue, it's pretty clear that across the board, everyone's going to want to do it. It'll be interesting to look at folks that are primarily driven by fee for service, that have more of a quality component, that are capitated, and how that levels out in different places over time, and also how that influences their ability to address kind of additional social and financial contexts that have to do with technology, in addition to food and housing and some of these other areas that I think have become more and more at the front of consciousness recently.
And Dr. Willis, I would love your perspective on this topic as well, knowing that you do a lot of work in the SDOH space and the clinical programs that you run, and you're a managed Medicaid plan for the state of Tennessee, serving their most vulnerable populations. And you have a state that has a big mix of large urban centers as well as really rural geographies. And so how are you thinking about the tool set of virtual health and telemedicine as a way to kind of, manage those populations across the different dynamics you have in the state?
So we are mostly a rural state, and for the most part, we did see that access was improved because of this rapid expansion, but it also shone a spotlight on where there were disparate areas as well. And we decided that we did not want to miss this moment to actually being a part of true public health. So we gave a grant to the Tennessee Department of Health, for example, to improve access in some rural areas. We joined with other companies to increase broadband access. So that's actually something that's about to start now. So we definitely wanted to do what we could from, within the confines of our business, but then we used our foundation to support things that the community could do. So I think what this has done is brought all the right stakeholders to the table for us to go in collectively to support increased access for everybody.
Okay, great. Yeah, certainly an important role to play to get into the reaches of populations that otherwise would have gone without, because they just couldn't access care in the 8 to 5 construct in an office. And as you said, Sue, like, I got to drive you know, wherever, if I'm in a rural area, I got to drive 40 minutes to just get to the local PCP office. And so a really important tool for how I might be able to improve access to care overall. There are a couple of comments and questions I can see in the Q&A around data security, as we move more into virtual health spaces, cybersecurity. And so Sue, would love your comments on how you're thinking about how to integrate some of this data back across multiple channels, and then how to manage some of the privacy and data sharing constraints that happen when you're doing things over a different modality.
Yeah, the great set of questions. I mean, clearly on the privacy and security front, as Jake mentioned earlier, part of what facilitated things moving along earlier this spring was the removal of some of the HIPAA-related constraints just to get us up and going. Moving forward, however, we're going to need to ensure that we're using HIPAA-compliant platforms and doing all that we can to manage data security breaches. And we know that those are a fact of life at this point for us in some form or fashion in our lives writ large. And yet healthcare is very, very, very sensitive. People's health data is very sensitive. So we have to really take that very, very seriously. I think in terms of, I know there were some questions in the chat, and Marcia, you alluded to it. I think one of the historic barriers, I think Jake referenced this earlier, to the concept of any anything was that people viewed it as like some other fragmented add-on that was going to just make things more confusing, and lack of coordination of care or disintegration of care, so to speak. And I think what I'm personally hopeful for, and what I believe from a regulation standpoint could be helpful to us, is with the interoperability rules, which are still somewhat theoretical per, one of the questions in the Q&A box, but they're going live first half of next year, with the mandate that people's, patients' clinical and claims data is digitally available to them, and people can grant access to that to third-party apps, and you have to expect that a lot of the funding, a lot of big tech players are going to want to be glomming into that space. I think it becomes a game changer, because then it's sort of like I can share the notes, I can allow greater coordination of care. I don't have to, I don't have the same concerns about, oh, I did this lab test here, but now I got to do it again over here, because we see the results one time and they're captured and they're there. And so I'm sure it will take some time. It's much easier said than done. But I think that getting rid of some of the data traps that have existed before, and increasing that, what people refer to as the data liquidity, I think is going to be one of the key enablers to the success of this moving forward.
Yeah. And
you mentioned, go ahead, Jake. Sorry,
Marcia,
go ahead.
Go for it.
No, go ahead.
I'll echo that. Should we find ways to do that, the opportunity on the other side, I think, is incredibly exciting. And the data assets that come off of these virtual interactions, I think, will allow us to look at performance and allow us to look at quality and drive data-driven continuous improvement in ways that I think has been very challenging in some parts of healthcare, where it continues to be considered a very bespoke, very personalized, very relationship-oriented thing, which is very true. But I think in some cases it's been hard to look at performance, look at standardization in ways that would be good for patients, and drive improvement accordingly. And I think, in some of the areas where we work, we've been able to take service lines and service areas where it's been really hard to understand what's going on and to hold teams accountable and to drive performance improvement, and really capture a lot more rich context about how care teams are interacting with patients, and use that to figure out what's working best for different types of patients, and how to upskill care management teams to provide the best possible support to individuals according to what we're learning over time. If you take a look at a telemedicine visit, if you can look at how the physician's interacting, how the patient's interacting, how they're responding, you can pick up signals that are coming off of that. I think there's so many different opportunities that can be built on top of some of the infrastructure that we're just putting in place now, that will hopefully improve the provision of care and the experience for patients. But certainly data security risks exist today, and with proliferation of data, they only become more significant.
Yeah, okay. Well, we have about 10 minutes left. I would love, and we've gone through a lot of different topics on a really broad space. and tried to hit on many of the questions that came from the audience, which hopefully we did some of them justice, but of course couldn't get to all of them. But I'd love to give each of you just a couple minutes to kind of summarize what your kind of key takeaways for leaders in organizations would be. And do you really see this as a future mixed model, and that we're not going to fall back into old habits and have this COVID experience kind of wane away, that this will be the future? And what are some key takeaways, if that's your vision, for leaders to take back into their organization? Just a couple summary thoughts on that. And so Dr. Willis, I'll start with you if you don't mind.
I think this is definitely here to stay. I think what this crisis has done has summoned us all to the table for public health. It's about all of us bringing what we can to do to help us not only get through this, but to be better on the other side of this. So I definitely think this is here to stay. I think we do have to make sure that we talk about quality, as I mentioned before, because we owe that to the people that we collectively serve. So quality has to be a part of the conversation, how we protect them, not only their health, but their security, what's just been brought up. So as we appeal to legislatures and things like that, we want to make sure that we have those things that will support the provider community to make sure that security is there, but to keep this thing advancing. So we definitely want to do that. I definitely think, again, with this being a public health concern, that we have to think about all those social determinants of health that we have a chance to impact with this technology. Like, we really cannot miss this moment. So I'm excited to see what we will do about that. And I just hope that we keep the collaborative spirit that we have right now. I think you hear it about 1 million times right now, we're better together. And that's definitely true. And I think that we can't go back to the way we were. We should not want to go back to the way that we were. Now we just need to hone in on those things that will make this better, that will give that security there, that make sure there's no fraud, waste, and abuse in this, and how we can ultimately improve care and just make it better. That's really what I want from this.
That's great. Sukanya, your kind of summary thoughts?
So my summary thoughts would be, I agree. I think we are at this tipping point and there is momentum. And yet at the same time, we have to be careful and vigilant that we don't let it stall out. And it can be easy to stall out in many respects because the status quo is just hard to shift. The status quo is sticky in every part of our world. And so a few key thoughts. The first is, let's look for the silver lining in this crisis, or the set of crises that we're facing, otherwise known as never let a good crisis go to waste. And I think, we have an opportunity here to expand the aperture and really lean into what the needs are of our patients and our members, the economic climate, that our customers are facing, our providers are facing, and really reimagine and rethink what our business model is to support these types of innovations. So that's the first thought. The second thought is that we got to think data and think digital, and I think both Jake and Dr. Willis talked about this. We now have an opportunity to test and learn and track and change and monitor and so forth moving forward. And we have to do that. We have to use this as an opportunity for continual learning and improvement. And we have the data at our fingertips and additional data. We have more data than we could possibly want moving forward. And then the final point is it's a team sport. To Dr. Willis's point of better together, it's a team sport. I think that means within our companies, we got to work across the different silos, right? It's about veering into different kinds of lanes. You can't be talking about service on one hand and digital app on another hand, and digital care management and regular care. It comes together. And then even outside of the company, it's about partnerships too. I think a lot of this we can't go it alone. And so how do we partner across payers and providers? How do we partner with innovators and others, all in the service of what is best for our members and our communities?
Yeah. Thank you. Jake, thoughts for you?
Yeah, no, I think you both said it well. Maybe just to build on that with a few comments. I think it's dangerous to make too many assumptions about what life will be like on the other end of a global pandemic when you're in the middle of a global pandemic, just given all of the biases that are fraud. But I think to echo what's been said, don't take it for granted, right? I think that use this as an opportunity, from an epidemiology perspective, we call this like a natural experiment, right? Where this would never happen, but then it did, and learn as much as possible about what people want and how you can provide care for them, and what's going to make sense for patients, for members, and for healthcare organizations going forward. At the end of the day, I think healthcare is really about relationships. And if you look at every other area of the world, digital has totally transformed the way people relate to each other, right? And so I think it is inevitable that this is and will continue to happen in healthcare. And I think organizations that can think about that as part of their core, and think about that not as something that's on the side and something that's tangential, but will define in a primary way how they relate to people going forward, are going to be successful. And so I think this is an opportunity to get a lot more insight into what that world looks like. But folks have to kind of build on what's happened so far versus kind of regress once the parameters change.
Great. Before we close, there was one question here at the end that I thought might be a nice personal aspect to it. The question was if the panelists themselves have been using telehealth, and what were the pros and cons of the experience. So I'll go first. I have certainly used telehealth as a consultant who travels 4 to 5 days a week for 20 years to be out in the field with my clients of different parts of the industry. I have used telehealth on a number of occasions because I can't get to my PCP because I'm 5 states away. And so if I had not been able to kind of reach into a telehealth kind of provider for that kind of thing, I would have just gone without care until a weekend, and my health would have probably gotten much worse over the course of me delaying that kind of interaction. So my experience with it has been a core toolkit of how I manage my healthcare, and it has been for several years. Sue, what about you?
So I have not, primarily because my spouse, my husband, is a physician. So when I have a question, I tend to turn to him. That being said, I could, for better or for worse, oftentimes it's like, oh, that's nothing. And I'm like, no, it really is something. I have observed how he's viewed telehealth. And I will say on the plus side, in light of COVID, and he was serving, in the COVID ICU and on the front lines, but for his other patients, he's a nephrologist, he really greatly appreciated the ability not to have them come in and their own safety, and appreciate the convenience of being able to do some things even from home. That being said, there are some patients for whom he really missed out on the in-person. He likes seeing the nonverbal cues, especially for some older patients or the caregivers that come in with them. They have a relationship and a rapport that just doesn't quite translate on the little screen. So it doesn't work in all situations and for all people. But those are two sides that I've seen sort of secondhand.
Yeah. Dr. Willis, you're a physician yourself. Have you had to reach out and use telehealth as a tool to manage your care?
Did, and it was actually very funny. I've known my doctor for quite a while, so I get on there and it's hard for me to be the patient sometimes. So at some point during the visit, she did have to say, would you be quiet and let me be the doctor? And I'm like, got it.
That's great. Jake, I'll leave the last comment to you.
Sure. My wife and I have a 5-year-old and a 20-month-old, and we've had a couple kind of well-visit checkups virtually, which were helpful and better than nothing. But I'd say pediatrics is probably an area that's not going to go 100% virtual anytime soon.
Despite the ubiquitous television ads of the mother getting up at 3 a.m. and doing a telehealth visit in the middle of the night. Well, thank you all so much. I really appreciate the dialogue and your perspective and sharing that with the group, and your flexibility to take questions on the fly. And so thank you very, very much for the time today and for the work that you're all doing in the industry and moving this forward. Thanks again to the health team and to the WellFrame team for organizing this, and I'll hand it back to the health team to take it from here.
And to all of our panelists, if you'd like to continue the conversation, please join us on Twitter. And now we would like to welcome to the virtual stage, Dan Chan.
Hello, my name is Dan Chan, Master Magician, and we're just waiting for several people to join us. Perfect. How's everyone doing today? My name again is Dan Chan, and we're going to do a little bit of magic and mind reading for you. In order for you to speak, you're going to need to hit the space bar to unmute yourself, and please do share your screen if you're live. Perfect. Let's start off with a quick experiment. I'm gonna have Lisa help me with this.
Right.
And Andrea, you will be next with that. How are you doing, Lisa?
Great, how are you?
Excellent. I'm gonna give you a chance to perhaps win $100.
All right.
If I'm not able to influence you, you'll get the $100. Let me spotlight myself. I believe I am a co-host. If you can make me a co-host, that would be appreciated. Okay, so go ahead, Lisa, if you can. Please choose one of these books. One is the Book of Secrets. One is Psychological Subtleties. Again, one is Secrets. One is Psychological Subtleties. And don't let me psychologically subtly influence you in any way.
I will do Secrets.
Are you sure?
No, but yeah, let's do Secrets.
Give you one last chance to change
No, we'll do, damn it. We're gonna do Secrets.
Okay. Indeed, it says you will choose this book.
Damn it. No, should have gone with Psychological Subtleties.
And not this book. See, I did try to give you a chance. I did try to influence you, and I did want you to win.
Oh, could have tried.
Andrea and Richard, how are you two doing?
Good.
Hey, how are you?
Excellent, excellent. Richard, I would like you to help out. I just want to see how your brain works right now, okay?
All right.
Richard, I am trying to transmit a number to you. It's a number between 1 and 50. Both numbers are odd, and both numbers are different. What number do you sense me transmitting to you?
17.
And you could have said it's any number, and none of this is prearranged, correct?
Correct.
Pretty darn amazing. The number 17. For those who believe, no proof is necessary. For those who do not believe, no proof will suffice. Lisa?
Yes.
I can have you help me once again.
Okay.
Andrea, you're also going to help me with something, and you can take a look at that in a second. We'll just prep you out here. Lisa, if you could have me, I want you to think of a person, place, or thing that evokes a positive thought. And it's so important now more than ever to think of thoughts that are positive. Your thoughts determine your actions determine your habits, and your habits determine your destiny. So please, for the first time, name the thought that you're thinking of.
A beach that I like.
A beach. Did that just pop into your head?
It's like the third thing that popped into my head, but I do really like it a lot.
Was by any chance the first thing like sunshine?
No.
Okay, a lot of people say a beach. Some people say sunshine. The last person said sunshine, but I did have something right here that I wanted to show you.
What? That's ridiculous.
Let's get everyone to go to Instagram. I'm at Dan Chan Magic. Dan Chan Magic on Instagram. On the top link, you can see something that says 11Z, and that should be a picture of Harry Houdini. When you've got that, please give me a thumbs up. We're waiting. Okay, that's perfect. Richard, for the first time, can you name any playing card at all?
Queen of Hearts.
Queen of Hearts. Did you know Queen of Hearts is actually one of the most commonly thought of cards?
Did not.
In fact, I knew you'd say the Queen of Hearts. Do me a favor and zoom in close on your phone onto the picture of Houdini, please. Do you see that? Can you share that? Can you lift your phone up so you can show everyone else watching from home what you see in Houdini's eyes?
Yeah, give me a minute.
What?
Or Lisa? Let me spotlight you for just one moment. You can see a Q in one eye, and scroll to the other side, please. And you can see the hearts in the other eye. And the audience goes into spontaneous, unsolicited applause. Any questions? I want everyone here to think of a number between 1 and 100, please. Is anyone thinking of a number between 20 and 40? No? Okay. Before we get to that, I would like you to help me out. Is anyone here married? If you're married, please raise your hand high up into the air. Richard, you are married. I want you to think of your anniversary date. Do you remember what you did on your last anniversary?
I do.
What is your anniversary first?
It is August 15.
August 15. And you've never told me this, correct, before today?
No.
Right here on my watch, I have 8/15.
What? Madness.
Andrea, can you please give me a number between 20 and 40? Just yell it out loud, please.
37.
37. In less than 37 seconds, this is my son, James. He'll show you something absolutely amazing. Remember, James, don't mess this up. Otherwise, it means no Disneyland.
About Hawaii. Here you go, Dad.
You could have said any number, but you said the number 37. 8 plus 11 is 19, plus 7 is 36,
17.
plus, yes, plus 17 is 36, plus 1 is 37. 16 and 2 is 18, plus 7 and 12 is 37. 3 and 19, and 9 and 6 is 37. 10, 15, 19, 37. 1, 13, 19, 37. The diagonals add up to 37. The four corners add up to 37. The four center numbers add up to 37. In fact, all these combinations we're circling add up to 37. But we didn't stop there. Those outside four. The outside four, all the outside four roots of the 9 add up to your number 37. If you win $37 million in the lottery, make sure you give us 37%. And if any of you need a new CFO for any of your healthcare needs, please do contact James at danchanmagic.com. Thanks, James. Excellent. I have one final thing right here. A little gift. Lisa, how are you? Again.
Great. Thank you.
Excellent. I have something right here in my notes application. Before we get to that, I'd like you to name a number between 1 and 100, please.
Sorry, you cut out for a second. What was the question?
Say a number between 1 and 100.
73.
73.
Yes.
Is someone raising their hand? 73. Inside my notes application is a list of beverages. What do you see on number 73, please?
Oh, wait, go down. Prickly superfruit water.
Prickly superfruit water.
Yes.
I would love to share a prickly superfruit water with you all.
That is bananas. I didn't even know that existed.
Yeah, you can look that up on Amazon.
I might.
Yeah. There's a lot of things that you don't
have in that bag.
Today, only one.
Blowing my mind, man.
What's more curious for me and many of you who are observant, you're probably looking behind here and you probably see something. Let's take a look. Inside the sealed envelope,
great logo.
is a small prediction. On Tuesday, July 28th, 2020, Richard will choose the Queen of Hearts.
What?
Lisa will want to visit the beach. Richard will think fondly of his anniversary on August 15th.
What?
Finally, Lisa will choose the number 73, and I would love to share a prickly superfruit water with you all.
Wow.
Thank you very much. Again, my name is Dan Chan, and you guys were a wonderful audience. Typically, when I say that's the end of my show, the audience yells out spontaneously, encore.
Encore.
Richard, Andrea, please.
Okay, encore.
Encore.
Audience participation. Excellent. Now, nothing has been prearranged. Andrea, I need you to give me a symbol, please.
A symbol?
Yes, please.
A diamond?
A diamond. Richard, please give me a symbol as well.
A heart.
And finally, Lisa, one
symbol. Crown.
A crown.
Does it have to be a symbol?
That's fine. I'm going to try to draw that as well as I can. As you can tell, I did not have a lot of time on this. So we have your signed card. There's no other card like this in the world. This is as if you were to see this live. The card goes into the middle of the deck. And you can see slowly the card jumps to the top. Whoa. I'll keep on doing this until everyone applauds.
You already got me. That was impressive.
Thank you. It gets better. We'll do it face up.
What?
You can see I haven't done anything sneaky just yet, but I will in 1 second. You can see the moment it goes in.
What? Blowing my mind.
Richard, feel free to be a little bit vocal about it. Lisa, thank you for being vocal.
No.
Okay.
Indeed, the only signed card. No gimmicks, no gadgets, 100% sleight of hand and sleight of mind.
It's getting close to us.
Your signed card. Lisa, Andrea, Richard, thank you once again for watching. My name again is Dan Chen, and you guys were a wonderful audience.
Thank you. That was very impressive.
Thank you so much, Dan, and to all of our audience for today. Have a great rest of your day.
Lisa, am I going to hand over the host's privileges back
Yep.
to you? Yes? Okay.